listeners. On behalf of the National Network of Public Health Institutes, it's such a pleasure and a privilege to have this time with you today, Dr. Dyjak. Congratulations to you on your important work and impressive accomplishments, and a very special welcome to all of our listeners. I am Vincent LaFranza, the President and CEO of NNPHI, and I'm energized for us today, so we are so glad you're joining our podcast series. Today we're talking about the importance of environmental health's role in the response to COVID-19, and this has many facets, of course. So let's dive right in. Dave, please tell our listeners more about yourself, your background, and what led you to the position you are in today.
So, Vinny, I'm getting really old. I've been in public health over 30 years. It's incredible. And now that I have little hair left on my head, I think it's because of all the dynamic conditions associated with a career in public health. I'm a board-certified industrial hygienist, and I'm privileged to lead the National Environmental Health Association. We represent primarily local governmental environmental health professionals, although we have a growing constituency in the private sector. Of that 6,500 members, 60% are in the government, 40% in the private sector, and most of them are involved in retail food in one way or another. But we also have members in the uniformed affiliates, that is anyone in the uniformed services, and there's now 8 of those. There used to be 7, now there's 8 because we now have the Space Force. I don't know if you're aware of that, but that's been added as a new one under President Trump. And we have many friends and colleagues in U.S. territories as well. And I hope that kind of gives you a background of us. We're in the capacity building business, just like NNPHI. And thank you so much for the invitation today.
Oh, great. We're glad to have you. And I also enjoy the fact that we share some background, both working for NACCHO in the past. What a wonderful experience that was for me. So when I worked back in the day in Superfund, we were heavily trained in identifying and reducing or eliminating exposure pathways as a means to reduce risk of hazardous and toxic contaminants that enter the human body. I think COVID-19, of course, poses many of these same challenges, right? So maybe you could share a little bit about what you think the needs and challenges are that the environmental health workforce is currently facing.
Well, I think it's important to recognize that environmental health is profoundly local. It is what plays out in your living room, in your kitchen, your local grocery store, and restaurant. And as we reflect on the public health workforce writ large, there are 2 major constituencies that make up that workforce. And I know I'm going to upset some people, but let me get it right out in front of our listeners right away. Nursing, public health nurses, and environmental health professionals make up the bulk of the public health workforce. And as we think about COVID-19, environmental health professionals have many supporting roles, also some leadership roles, which we can unpack. But it is our public health nurses that are probably doing a lot of the vaccination as we're recording this podcast. But it's EH, because it's the second largest part of the workforce, is being redirected from what they're currently doing. It could have been restaurant inspection, land use planning, it could have been inspections of daycare facilities or schools or the hospitality industry. I could go on and on. But many of the environmental health professionals are being redirected at this time to support the COVID response and recovery. And like a lot of disasters, the environmental health component plays out long after the cameras go away, long after it's front page news. It is the environmental health profession that's there to do cleanup, frankly. And just think about it, as Florida opens up and Texas opens up and Wisconsin opens up, these restaurants that people are dying to go to, someone's got to go back in and inspect them to ensure that they're suitable for the occupancy that they're expecting. And then there's the secondary questions about air quality and the distribution of the COVID virus through the air column. So it never seems to end. And we could talk about many different facets, but it's really pushing the governmental environmental health workforce, I think, to its limits at this time.
Yeah, all great points, Dave. So let's dig into that, the limits here. Can you maybe share a little bit about what you think the biggest training needs are for our environmental health workforce, as it relates especially to prevention, control, and education?
So I think at this time, as we consider reoccupancy of our back to our normal lives, whatever that means, and maybe you could fill me in on what your definition of that is, but as we go into buildings that have been only partially occupied over the last year, it is indoor air quality issues that I think our environmental health professionals need to be dusting off any training and education that they've had in the past and refresh that, whether it's Legionella in premise plumbing inside of buildings, whether it's roof leaks that have occurred over the last year that haven't been maintained, whether it's the air filtration in those HVAC systems, and then frankly, the density of the occupancy and the operation of those HVAC systems, I think are really important. Most of us spend 90% of our time indoors, Vinny. I think you already knew that. And so as we move from restaurants and schools and daycare, in commercial buildings, office buildings, we need to think really carefully about the population and ensure that the conditions within those facilities are suitable for human occupancy.
Great, all great points. I wish I had a real good definition for the future of what normal looks like, but I think we're all sort of exploring what that is. But I always do believe in the original ILM definition of public health being what we do as a society to ensure the conditions in which people can be healthy. And so I think the part of the new normal is going to be thinking about where we spend our time, how we spend our time, how many people we're with, even after the vaccination program is done. So environmental health will be playing a critical role. So we look forward to supporting that, especially in the training. NMPHI does a lot of training with our workforce partners.
I think that there's a role for NNPHI as there is for organizations like NEHA. I hope we just don't move on to the next crisis, Vinny. I mean, we need to get up on the balconies of our minds, and some people call those a hot wash, right? I mean, with inside the ballpark conversation. But I hope that we really reflect on what happened over the last year and a half and learn from it and ask ourselves, how do we not repeat some of the, I think, pretty horrific outcomes that we've had this last year. I think the most recent mortality data I've seen from COVID is over 500,000. I could be wrong, but I think it's over 500,000. And, that's profoundly disturbing to me. That's more than the losses in the Civil War, in the Vietnam War, World War I and World War II. And so I'm deeply disturbed. I personally know people who have died of COVID, and it's not about me, it's about all of us, but let's learn from this. And I would hope that NEHA and NNPHI and others could caucus together and ask, what did we learn and what profound recommendations can we make to our constituents, our stakeholders, and our investors moving into the future? And sorry, I interrupted you, but I just wanted to kind of share that perception.
No, this is great, and you're right on. I couldn't agree more. So yeah, we've lost about 530,000+ people in this country alone. A number that is, a lot of that was preventable, and that's the role of public health, right? And so we do have to learn, and it really does, it's touched all of us. I mean, we've had some of our own staff members have lost family members. I would say you also led into the next question beautifully. So are there any major misconceptions, in your opinion, about the environmental health workforce that you've seen arise from the COVID-19 pandemic?
Well, I think I would share what is, I think, universally recognized, and that is public health and environmental health. Everyone in the prevention oriented work got marginalized. It's the politics of public health. And I think we saw that play out over the last year. As we watched the news today, and today is March the 24th, 2021, what I see in the news are physicians and others that are talking on behalf of environmental health. And I think our organization, and perhaps even me personally, failed to figure out how we get the right spokesperson out in front of the media, out in front of decision makers. Because no offense to physicians, they're great people. I have a lot of physician friends, but they're not the most informed on environmental health practice. And I'm asking myself, how do we get practitioners who know their local populations. Vinny, you used to work at NACCHO. We just started talking about that. You know that environmental health professionals spend a lot of time in the field. They know the local regulated community. I was in Minnesota a couple of years ago, and I was told that their inspectors speak 18 languages, environmental health inspectors. Ask yourself, why is that? Because they have to, because they're out there working in those communities. So we know the culture, we know the language, we know where the risks are because we're out there every day. And regretfully, as I see, influencers being interviewed, none of them are environmental health professionals. But yet the major issues that we're encountering right now are environmental health. Just using restaurants, for example. Everybody wants to go out to eat. Well, how do you do that safely without putting your servers at risk, the cooks at risk? I mean, no one wants to inadvertently pass this disease along. So I hope that kind of gives you an idea. We're still the invisible profession to some degree. And we're working on trying to reframe that, and we're still trying to figure it out, regretfully. Frankly, before I retire, I'm hoping to have a solution to that. We'll see.
Yeah, no, Dave, I feel that. And so when I think back to my work with CDC HSDR, starting out my career and then moving into NACCHO and the other work I've done with the institutes over the last couple of decades, it's really clear to me that we've separated environmental and public health in such a structural way that it has had enormous implications for communicating with the public, with policymakers, with the media. And I think the practice of public health really needs to bring all of that back under the same umbrella, and including the EPA work and all of the broad environmental work, and even EPA is a separate institution outside of HHS, as you know. So I think there is a lot we need to do structurally, and then also with working with elected folks so they understand how their policy making is could make a difference locally on the ground, as you say.
Yeah, we need to do a better job of the science of affect heuristics. That is the way people think and make decisions. This is one of my key speaking points when I'm dialoguing with our constituents. Think about vaccine hesitancy, for example. There's a lot of that in the country, unrelated to COVID vaccines, just measles, mumps, rubella. And what we find is that when those diseases move into communities, surprise, surprise, mothers and fathers become much more interested in vaccinating their children. That's because they've been emotionally activated. And so when we have a condition where we're emotionally activated as a society, I think we in public health need to take advantage of that. And we're so busy collecting our data and making sure it's right that we miss that portal. We miss that open door. And it's the nimble nature of our work. I think we need to do a lot better at just saying it's not perfect, but let's go while the opportunity is there for us to communicate to people while they are emotionally activated, as opposed to collecting data, analyzing it, and saying our t-tests and p-values and chi-squares report this and this. I think we should show up as fathers, as mothers, as partners, as brothers and sisters, and say, here's what we know. And as we're talking about the environmental health profession, I just got done making the case, hopefully compelling. We speak the local language. We know the local regulated community. We have no interest in putting anyone out of business. That's bad for us, right? So it's that trust issue, and making sure that we're a trusted voice, we're a trusted personality, and that we come across as a human beings first and scientists second.
All great points, Dave. So when we think to the future now, what are you most looking forward to with the partnership between NNPHI and NEHA, and how can our two organizations better serve the greater public health workforce?
So I think each of us have a bite of the apple, Vinny. I think in the spirit of reducing or de-balkanizing the profession. I mean, we sadly compete for the same resources often. Where we can collaborate and partner and genuinely do that. And we're delighted with the work that we're engaged in now with NNPHI. Let's continue to cultivate our organizational relationships. Let's ensure that there's a deep well of trust between the staff, between you and I, for example, because we have outsized influence. If Vinnie LaFranza says, call up NEHA and work on something, that would happen. And I think you and I have personal responsibility in ensuring that we get the major leverage out of the dollars that are invested in us on behalf of the public's health.
Well, you have our support, and we'll do more for sure. How can the rest of public health and its workforce elevate and support the environmental health field as the current pandemic continues?
Well, thank you for asking that question. Can you invite us to the party, please? And what I mean by that is there are many decisions being made all across the country as it relates to COVID. Oftentimes we feel like we're on the outside looking in as a profession. We are called up, say, hey, guess what we decided? You're going to do this and this, as opposed to being there at the decision making, to be inside the EOC, the Emergency Operations Center, for example, to be part of that conversation. And I'd say, please invite your local environmental health representative to the dialogue early. We are ready to come and make contributions, to listen, to lead if we need to partner if that makes sense, and to follow where we can make a major contribution. But most importantly, because environmental health is governmental environmental health, Vinnie, is not part of a local health department. Most people don't understand that. In many cases, it sits in a different agency or it's its own agency, and it's easy to forget it. I would say, please remember to invite your local EH representative, however they appear, whether it's an ag, whether it's a standalone agency, whether it sits in some other HH, health and human service type of agency at the local or state level. Be sure you give them a ring. I guarantee that they'll be delighted with the invitation to join the conversation.
Wow, what great advice, Dave. So we have a lot to do together in the future, and I look forward to it. Thank you so much for sharing with us today. And as our nation begins to recover from this pandemic, the importance of our public health efforts have never been more valued by all communities. And a special thanks to all of our listeners, and stay tuned for more NNPHI podcasts. Wear a mask, watch your distance, stay well, engage in lots of self-care, and remember your environmental health colleagues all across the country. Over and out for now. Until next time.